All right, today have something to talk about. On the series of STR, today we have a look at HPV, human papilloma virus. HPV, human papilloma virus, is the most common sexually transmitted infection the world over, according to statistics. And about 80% of sexually active non-vaccinated individuals have had the infection at one point in their lives. And many people may be asymptomatic. They may not know that they have this infection. And of course, before the advent of vaccine, about 340,000 to 360,000 people had this infection every year. But since the advent of vaccine, the number has decreased. Howbeit, we do not know statistically the number of people that have this infection in the developing countries, because the statistic here is that of US. So there are more than 100 types of HPV, but there are those ones that will be of concern to us today. So what are the types that we are going to look at? HPV affects the epithelium of the skin and present with common skin warts. But there are others that affect the anogenital mucosa, the genital areas, the anus as well. In all of these, there are some manifestations of HPV. HPV present with clinical conditions. So let's have a look at some of the clinical conditions that are associated with HPV. Genital warts is one of those medical conditions that is associated with HPV. Genital wart or anogenital wart, otherwise known as condyloma acuminatum. Then, of course, apart from this, intraepithelial neoplasia and carcinoma of the cervix, carcinoma of the vulva, carcinoma of the vagina, and of course the rectum and the anogenital area, and including of course the penis. Apart from this, HPV also is associated with oropharyngeal and laryngeal carcinoma. So, how does this infection get into the body? As we have said, that HPV is the commonest sexually transmitted infection. So, the commonest route of acquisition of this infection is through sexual means. But not only this, having skin-to-skin contact with somebody that has the virus can also cause the infection. Alright, so how does this HPV present like, apart from their manifestation in the various disease conditions that we have mentioned. So after an incubation period of 6 months, a person may notice a smooth, minute lesion. Okay, a smooth, minute lesion around the anogenital area. This lesion may become enlarged, and it may also be has a rough surface. Okay, so the appearance of a small rash, and then it may enlarge. From enlargement, it can have rough surface, all right, and of course it can also become vesicular. Vesicular means that it contains fluid or water, in simple terms. So that is how this rash presents. Although some people may be asymptomatic, they may not have any symptoms, but some people may have itching, burning sensation, and discomfort. So, having looked at this, let's look at the places that this lesion may attack. All right, in the male, the virus will attack the foreskin. The inside of the foreskin is where the rash can appear. The condyloma acuminatum. That is where it can appear, and of course, it can also be found in the penal meatus, the shaft of the penis, and the corona can also be found on the coronal area. Moreover, you can also find it around the anus. In the women, the rash could be found in the vulva, the vagina, and the cervix, and of course the larynx and the oropharynx can also have this lesion. The virus can affect these areas as well. So, why are we so peculiar about this rash? Why are we talking about this rash? The reason why we talk about this infection is because it is the commonest sexually transmitted infection in the world, and a lot of people do not know that they have it, and they may be sharing it with others. So, what should be done about this infection that is the most commonest in the world is to have vaccination. There are various types of vaccination. Vaccination can prevent against this infection. And of course, it must be said that HPV type 16 and 18 is linked to all cases of cervical cancer, which means a woman that has this infection may have cervical cancer in the future. Of course, before it gets to that place, there may be what is called intraepithelial neoplasia, which will predate or precede cervical cancer. So this is why everybody should know about this type of infection, human papilloma virus or HPV. So it can lead to cervical carcinoma, and some even say that the virus can also, in some extent, lead to vesicular carcinoma, that is cancer of the bladder. So if somebody has this or notice this kind of rash, what should they do? What they have to do is to go to the hospital and see a doctor who will carry out some investigations and then treat the patient accordingly. I have seen it a number of times, people coming down with this. See, I'm particular that we should know this thing, because a lot of times people will go to quacks and be buying medications and taking all sort of things. This is a viral infection. It's not any kind of infection. Some people may have this infection and within 1 to 2 years the rash will clear up, but some people will have it a long time. And of course, the method of treatment will depend on a number of factors, including the number of lesions that the patient has and the location of the lesion. There are so many things that could be done by the doctor to ensure that the patient is properly treated, so that they do not come down with complications such as cervical cancer or even oropharyngeal cancer and the rest of the complications that might come with this infection. And of course, not only can this infection be transmitted through sexual means, having bodily contact with somebody that has the lesion, somebody can be infected in the process. Touching the rash with one's hand and using it to touch the skin may make somebody to have skin wart, or what is called a common skin wart. Having any form of sexual contact apart from penetrative sexual intercourse may also predispose somebody to having this STI. So if somebody notices this kind of rash, they should not waste time. They should not be, oh, let me go and see someone, get some medications, let me drink herbs, because in the process of trying to drink roots and herbs, someone might be doing harm to oneself instead of doing the right thing. So when you go to the hospital and see a doctor, the doctor will order for investigation after history might have been taken, and then the rash will be examined. There are so many means, so many things that the doctor can use to remove the rash, but the essence of the video is not to give treatment. The essence of the video is to give information and to help you find a doctor, help you go to a doctor if you have this rash. So I'm not going to mention medical management. No, if you have this rash, if you have this kind of infection, if you notice a soft, minute, grayish polyp on your genital area, okay, it might be painful, it might not be, it might give you a tingling sensation, itching, okay, go and see a doctor. If you notice a rash that has a rough surface, maybe many, maybe clusters, okay, go and see the doctor. The doctor will know what to do for you. Right? And of course, if you are a woman, you may be at risk of developing cervical cancer in the future. When you go there, the doctor will carry out some investigations and be able to identify the type of the virus that is present in your system. This is a viral infection, and of course the rash can be clean. But let's say one thing here before we call it a day. People that have immunocompromise have a higher risk of having HPV, human papilloma viral infection. People that have HIV, people that may have other forms of immunosuppression have a higher risk of having HPV. So this is where we are going to call it a day on this STI, which is the commonest in the world. Right, so if you have a question, please drop it in the comment box. Please do not forget to share this video so that the application might recommend it for others to also see. Alright, so subscribe my page, like, comment, ask questions. If you have any question to ask the question, and I will do my best to get back to you as soon as I can. Stay away from sexually transmitted infection and prevent yourself from the complications of such infections. Till I come your way next time.